How does a CORT scan help diagnose IBD? Have you ever wondered how doctors can see what's happening inside your body when it comes to inflammatory bowel disease? One of the key tools they use is a computed tomography scan, commonly known as a CORT scan. This imaging technique is quite effective in diagnosing inflammatory bowel disease, or IBD, by creating detailed images of your abdomen. A CORT scan works by taking X-rays from various angles. These images are then combined to form a cross-sectional view of your internal organs, including the intestines. This allows doctors to observe the thickness of the bowel wall. When the wall is thicker than normal, it can indicate inflammation, which is a typical sign of IBD. CORT scans are particularly beneficial for spotting complications that may arise from IBD. These complications include abscesses, which are collections of pus, strictures that narrow sections of the bowel, and fistulas that are abnormal connections between bowel segments or other organs. Detecting these issues quickly is essential, as they often requiring immediate treatment. During a CORT scan for IBD, doctors usually use oral and intravenous contrast agents. These materials help to highlight the intestines and blood vessels, making any inflammation or abnormalities easier to see on the images. For individuals with sensitive stomachs, like those who may also have irritable bowel syndrome or colitis, a CORT scan is a non-invasive and relatively quick procedure. This can be less stressful compared to more invasive tests like endoscopy. However, it is important to note that a CORT scan does involve exposure to ionizing radiation. Therefore, doctors weigh the need for detailed information against this risk, especially since patients with IBD may need repeated imaging over time. While CORT scans provide a clear view of the structure and complications of IBD, they do not show microscopic inflammation or subtle changes in the bowel lining. Because of this, CORT scans are often used alongside other diagnostic methods such as blood tests, stool tests, endoscopy, and magnetic resonance imaging to get a complete understanding of the disease. In summary, a CORT scan is a valuable tool for diagnosing IBD. It helps doctors see bowel wall thickening and related complications, which aids in confirming the diagnosis and planning treatment. For those with sensitive digestive systems, it offers a quick and detailed look inside the abdomen without the need for invasive procedures, although the consideration of radiation exposure is always important.